When it comes to ADHD, many questions arise. After all, are we dealing with a real disorder, or is it just an overused label? The truth is that, over the years, a lot of misinformation has spread, leading to confusion and even prejudice. Who hasn't heard that ADHD is just a lack of focus or a problem with disobedient children? But is that really true? In this video, we will address the most common myths about ADHD and present what science actually says. Our goal is to clarify the topic in an objective and accessible way, helping you better understand this condition that affects millions of people worldwide. Over the next few minutes, we will explore what ADHD really means, how it manifests at different stages of life, and what the latest studies reveal about diagnosis and treatment. All of this is aimed at helping you separate fact from fiction and gain an evidence-based understanding. So, if you have ever had doubts or know someone facing challenges related to ADHD, stay with us. Get ready to discover surprising truths and debunk outdated concepts. To better understand attention deficit hyperactivity disorder, ADHD, it is essential to start with the basics. What exactly is it?According to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, ADHD is a neurodevelopmental disorder characterized by persistent patterns of inattention, hyperactivity, and impulsivity that directly interfere with an individual's personal, academic, and professional life. Unlike occasional distraction that everyone experiences, ADHD involves ongoing difficulties that impact crucial areas of daily life. Symptoms manifest differently in each person. Some struggle with organization and concentration in daily tasks, while others exhibit constant restlessness and impulsive actions. Furthermore, there are three subtypes of ADHD: predominantly inattentive, predominantly hyperactive impulsive, and combined, which includes characteristics of both. Many believe that ADHD is solely a childhood problem, but reality tells a different story. Studies indicate that about 60% of children diagnosed with ADHD continue to experience symptoms into adulthood, affecting their professional performance and interpersonal relationships. When left untreated, the condition can lead to difficulties in time management, financial impulsivity, low self-esteem, and even associated emotional disorders such as anxiety and depression. Science has shown that ADHD has well-defined neurobiological foundations. Research reveals that it is linked to atypical functioning in brain regions responsible for attention and behavior control, such as the prefrontal cortex. In addition, genetic factors play a crucial role, with studies showing that the disorder tends to run in families, reinforcing its hereditary origin. Understanding ADHD is essential to dispel misconceptions and foster a more empathetic and fact-based perspective. Now that we know what the disorder is, it's time to address the main myths surrounding it and analyze whether what we commonly hear actually holds true. Although ADHD is widely recognized by science, many myths continue to distort its understanding. These misconceptions not only generate prejudice but also hinder individuals with the disorder from receiving the necessary support. Let's explore some of the most common myths and confront them with scientific facts. Myth 1: ADHD is just a lack of discipline. Many people believe that ADHD results from lenient parenting or laziness, but science proves otherwise. Neuroscientific studies show that individuals with ADHD exhibit differences in the functioning of the prefrontal cortex, the area of the brain responsible for planning and impulse control. In other words, it is not a lack of effort but a distinct brain function that requires specific approaches to manage behavior and daily tasks. Myth 2: ADHD only affects children. Another common misconception is that the disorder disappears with age. Although symptoms may change over time, they do not completely vanish. Adults with ADHD may face difficulties managing deadlines, organizing tasks, and maintaining focus in professional environments. Research indicates that approximately 4% of the global adult population has ADHD symptoms, often without having been diagnosed in childhood. Myth 3: ADHD is caused by too much screen time and technology. The increasing exposure to electronic devices has led many to believe that ADHD is a consequence of excessive technology use. However, experts affirm that the disorder has biological and genetic foundations. While too much screen time can exacerbate inattention in anyone, it is not the cause of the disorder. ADHD is a neurobiological condition, identified even before the advent of modern technology. Myth 4: ADHD medications are dangerous and addictive. Many concerns surround the use of stimulant medications such as methylphenidate. The truth is that, When prescribed and monitored correctly by healthcare professionals, these medications help regulate neurotransmitters like dopamine, significantly improving symptoms. The risk of dependency arises only with improper use or lack of medical supervision. Myth 5. Everyone has a little bit of ADHD. This belief downplays the seriousness of the disorder, confusing occasional distractions with the persistent symptoms that affect individuals with ADHD. While anyone can feel distracted at times, the disorder presents ongoing and significant challenges that impact key aspects of life. Debunking these myths is crucial to helping people understand ADHD correctly and seek appropriate support. Now that we have dispelled these false beliefs, it's important to understand what science truly says about the causes, diagnosis, and treatment of the disorder. Now that we have clarified some common myths about ADHD, it is crucial to understand what science really says about this condition. Medical and neuroscientific research has made significant strides, providing a more precise and detailed understanding of the disorder, its causes, and treatment approaches. Studies indicate that ADHD is a neurobiological disorder with a strong genetic component. Research shows that children with ADHD often have close relatives with the same condition, reinforcing its hereditary influence. Moreover, neuroimaging exams reveal significant differences in brain regions associated with attention, impulse control, and emotional regulation, such as the prefrontal cortex and basal ganglia. This explains why individuals with ADHD struggle to maintain focus, organize tasks, and control impulsive behaviors. Another crucial factor is the influence of neurotransmitters like dopamine and norepinephrine. In the brains of individuals with ADHD, these neurotransmitters function atypically, directly impacting their ability to concentrate and plan. This is why medication, when properly prescribed, can help improve brain function and reduce symptoms. According to scientific guidelines, diagnosing ADHD requires a thorough evaluation that considers multiple factors. Mental health professionals use specific criteria to analyze a patient's history, their behaviors in different settings, and possible comorbidities such as anxiety and depression. Early diagnosis is crucial, as it allows for effective interventions that can significantly improve quality of life. When it comes to treatment, science suggests that the most effective approach is a combination of multiple strategies. Medication, when necessary, should be complemented with behavioral interventions such as cognitive behavioral therapy, which helps develop skills in organization, emotional regulation, and planning. Additionally, lifestyle changes, such as regular physical exercise and a structured routine, play an essential role in managing symptoms. Understanding ADHD from this scientific perspective helps eliminate misconceptions and promotes a more empathetic and effective approach for those living with the disorder. Now, let's explore some practical strategies that can assist individuals with ADHD in their daily lives. Understanding ADHD is the first step, but knowing how to handle the daily challenges it brings is essential for improving quality of life. Fortunately, there are several practical, science-backed strategies that can help individuals with ADHD gain better control over their routine and productivity. Small habit changes and environmental adjustments can make a significant difference. One of the most effective strategies is time management. Using alarms, timers, and productivity apps can help maintain focus on tasks. Techniques such as the Pomodoro method, which divides work into short intervals followed by brief breaks, are highly recommended to prevent distractions and keep the mind engaged. Additionally, establishing a prioritized to-do list helps direct efforts towards the most important tasks throughout the day. Another key tip is organizing both physical and digital environments. Having a clutter-free workspace, maintaining a consistent schedule for commitments, and using tools like digital calendars can enhance focus. For individuals with ADHD, messy environments can be particularly detrimental, leading to anxiety and procrastination. On the emotional side, emotional regulation techniques and mindfulness practices are excellent allies. Conscious breathing exercises and meditation can help reduce impulsivity and promote a calmer, more focused mental state. Cognitive behavioral therapy is also effective in developing coping strategies and impulse control. Moreover, self-awareness plays a crucial role. Identifying behavioral patterns, distraction triggers, and peak productivity times helps create a more personalized and efficient routine. Keeping a journal of activities and reflections can be a powerful tool for achieving this. Another important aspect is social and professional support. Having the backing of family, friends, and colleagues, in addition to seeking medical and psychological assistance, contributes to a more understanding and encouraging environment. Support groups and online communities are also great spaces to exchange experiences and discover new adaptation strategies. By consistently applying these strategies, it is possible to manage the challenges of ADHD more effectively. Now, let's summarize the key takeaways and explore how we can continue delving into this topic. Throughout this video, we have debunked misconceptions about ADHD and provided a scientific, evidence-based perspective on this condition that affects millions of people worldwide. We've learned that ADHD is not simply a lack of discipline or an issue limited to childhood but rather a real neurobiological disorder with significant impacts on personal, academic, and professional life. Understanding ADHD is the first step in breaking down prejudice and offering proper support to those living with the condition. With the right combination of treatment, practical strategies, and support, it is possible to enhance quality of life and tackle daily challenges with greater confidence. If you resonated with any of the points discussed or know someone dealing with ADHD, share this video. Quality information can transform lives and help many people find the support they need. And if you'd like to keep learning more about mental health and neuroscience topics, don't forget to subscribe to the channel and turn on notifications. See you in the next video.